Okay, my name is Susan Kerr, and I'm doing this short video on delegation for the ATI Live Review Part-Time Educator. Bear with me with the lights. Okay, the next thing we're going to talk about is delegation, the 5 rights of delegation. And what are those? Okay, make sure we have the right person, the right task, the right circumstance, the right communication, and the right supervision. All those the RN has to think about when we start talking about delegation. And we're going to talk a little bit about with the scope of practice to specific personnel that we may be working with. Okay, first let's talk about the RN. Who are the patients RNs take care of? Okay, we can take care of unstable patients, okay, or stable patients. We are responsible for all assessments, especially the initial assessment. Again, a key word, assessment. Okay, when you see that word, it has to be done by the RN. We teach. We do teaching. Always the RN does teaching, and you got to think about different words that go along with teaching. You may see in a choice. We also initiate the care plan for the patient. Okay, other people can bring problems to us that we can talk about, but the care plan initially started by the registered nurse. We also administer blood products. We're responsible for getting the blood, comparing it, doing the checkoff sheets, starting the blood, and staying with the patient for the first 15 minutes. Afterward, then we can delegate that to the LPN. The RN's also responsible for IV infusions, and we titrate them, we check the rate, and again we think about big bags, either medication or maintenance IV fluids. Okay. Also, the RN, the only personnel that can give IV push medications, and most of those medications are what? Okay, they may be for pain, and they may also be for hypertension or some kind of dysrhythmia that's happening to the patient. Okay? And let's take a look now at what the scope of practice is for the practical nurse or the vocational nurse, the LPN or LVN. What can they do? Well, they can take care of stable patients. Okay, we don't want to delegate an unstable patient to the LPN. They can gather data. Okay, they can help do assessments and help do assessment after the initial assessment. They're gathering data, okay, and they can report that to the RN if things have changed. They also contribute to the care plan. Maybe they've determined another problem since the original care plan was started, so they bring that back to the RN. Again, key words to think about. They reinforce teaching. While they don't start the teaching, they can reinforce it and certainly can help the patient do things correctly. They monitor IV fluids. Okay, they can make sure that the infusion that's hanging is mixed correctly, it's the appropriate fluid, it's at the right rate. And they also can monitor blood transfusions or blood product transfusion, whatever, once the RN has started the transfusion and it's 15 minutes into it and there's no reaction. And also, LPNs can give piggyback medications, can hang piggyback medications. And what normally are piggyback medications? Right, usually antibiotics, okay? Now let's talk about the assistive personnel, or unlicensed personnel, whatever you want to call it. What can they do? Of course, it's stable patients that they take care of. Always stable patients. They can obtain vital signs, but again, unstable patients, okay? If a patient's unstable or just come back from the OR, who needs to be getting those first set of vital signs? The registered nurse. Okay, so again, the right circumstance. They can gather specific data. Specific. And by that, what do you think I mean? Eyes and nose. Okay, they can measure that certainly. They can also determine how much a patient's ate. 75% of their lunch or 10% for breakfast. They can make the bed. They can assist in feeding a stable patient. Okay. They can perform hygiene care, giving a bath, washing hair, those kinds of things. Position the patient. Again, the right circumstance, think about that. And they also can ambulate the patient. So, think about the words that are being used and what it brings to mind when you're trying to answer a question, or in real life when you're trying to delegate tasks. So we're going to practice some. And I want you to think about the techniques we talked about when we first started the review, the stop technique. S, we want to make sure we know the story. What is the question asking us, what the issue is, who the client is. Next, T, we want to really think about what type of question or what's in the stem. What is it asking us? Are we looking for something that the nurse should do, or is it going to be a false type of question, something they shouldn't do, or is it a question that's looking for priority? So you need to determine that when you first read that question. Next, we're going to look at all our options. Okay, do they make sense to us? Okay. And then lastly, of course, we want to pick the correct one. And once you pick something, don't go back. Don't go back and second guess. That's where a lot of students and non-students get in trouble in taking the exam. We want to change the answer. Okay. So let's go with the first question. The nurse is organizing care for 4 clients. Which of the following tasks should the nurse instruct the AP to perform? Measure the emesis from a client who was recently admitted with dehydration. Sounds pretty good. Bathe and shampoo hair for a client who was just admitted after a motor vehicle crash. Now, normally I would say, yeah, bathe. But this scenario here, this client, she's just recently admitted in a motor vehicle crash, and I think this is a good time where the RN can do a good assessment. She may have some kind of injury, the patient may, that weren't detected in the emergency department, because they're looking for life-threatening injuries, right? So I'm going to think that should not be delegated to an assistive personnel. Provide assistance for a client who's requesting a bedpan that's just had a lumbar puncture. Now, yeah, we know the assistive personnel can put a bedpan under somebody, can assist in positioning, but think about this circumstance. This patient just had a lumbar puncture. Is that a special circumstance? Yeah, because there's specific requirements for a patient to lay a certain way once that they've had a lumbar puncture. So I need to not think about delegating that. And the last one, decrease oxygen on a nasal cannula for a client who's going home and has COPD. And what about oxygen? It's a medication, okay? So I can pretty much throw that one out for sure. So the correct answer we're going with is number 1. Measure the emesis from a client who was recently admitted with dehydration. People can read the lines on the urinal. So let's look at the next question, okay? Which of the following tasks should a nurse designate to an experienced assistive personnel? Select all that apply. Now, what are a couple of things now about the story? We have the keywords, experienced assistive personnel, okay? And we also have to select all that apply. And so those are some of the hardest questions for students to answer. So what some of the test-taking strategies for select all that apply? What are we supposed to do? Read each choice and decide, is that true or false? Okay? So let's look at these. Completing intake and output measurements. Can the assistive personnel do that? Makes sense to me. Yes. Feeding a client who has early dementia. Is that within the scope of practice? Yes. Okay. And it says early dementia. It does not say that the client had a stroke and difficulty swallowing. So that's a stable patient. So we'll say yes. Number 3, explaining oral hygiene to a client that's receiving chemotherapy. Now, if they're explaining something, what are they doing? They're teaching. Okay, we know who does the teaching. The registered nurse. So we're going to throw out number 3. Number 4, bathing a client 2 days after cerebrovascular accident. Patient sounds stable, sounds like the right circumstance, certainly within the scope of practice for an assistive personnel. So I would choose that one. Number 4. Let's look at number 5, ambulating a client who's 1 day post-op a hysterectomy. Now, ambulation, certainly within the scope of practice of assistive personnel, correct? Okay, and the patient sounds stable. 1 day post-op, no other information given to us. Sounds pretty okay by now. So I would say yes. And number 6, listen to this one. Assisting a client who has hypertension, select low sodium snacks. Now, what are they doing? They're instructing. They're teaching. Okay, and who's able to do that? What teaching comes under whose scope of practice? The registered nurse. So which ones did we say were true? Complete number 1, number 2, number 4, number 5. Okay, let's go to the next one. A nurse is supervising care delegated to an assistive personnel. The nurse should take corrective action if the following is observed. And these are a false response type of question, meaning what? When we see the wrong thing happening, we have to step in and intervene. Allowing a client to sit in a bedside chair while discarding bath water, that sounds fine. Pulling the curtain partially around the bed while performing perineal care, what's going on here? They're not providing privacy. So I'm thinking that's probably it, but I'm going to read the other two. Raising the head and lowering the side rail while repositioning the client. It sounds reasonable, safe for the assistive personnel. Answering a call bell or a call that rings to the hospital telephone while the client is away. Sounds pretty reasonable to me. Okay, so the thing we need to step in and intervene is number 2, when the curtain is not pulled around the client well enough. Okay, lastly, we have an infant that's admitted to the pediatric unit with watery diarrhea for the last 2 days. What action should the nurse delegate to the assistive personnel? Okay, keep in mind this is an infant. Think about how old they are. Okay, what does an infant look like that's going to have been in diarrhea for 2 days? Okay, and so in my mind, this is a pretty sick child. Okay, so what can we delegate? Obtain the infant's weight and length. Well, let's say I'm not sure about that one. Apply urine collection bag to an infant. Now, is that within a scope of practice, collecting urine specimens on an adult even? No, because we have to clean the perineal area, or if it's adult, instruct them how. So that's not within the scope of practice. Number 3, collect a stool specimen and send to the lab. Again, it's collecting a specimen. Is that within the scope of practice for an assistive personnel? No, we didn't see any of those words, did we, when we were looking at their scope of practice? And also, the RN needs to look at that stool to do an assessment. How much is it? What color is it? Is a large amount? That kind of thing. And lastly, look at this one. Place bottles of oral rehydration solution at the bedside or in the room. All they're doing is placing Pedialyte or whatever product the hospital uses there. They're not telling the parents how much to feed the baby. They're not doing any instructing. They're just bringing in from the solution in, right? Okay. So the correct answer is number 4. That's well within their scope of practice. Now, when I think about number 1, this is the initial assessment, even though it doesn't specifically say. But the key words, we're getting not only the weight, but we're also getting the length. And this, again, baby's pretty sick, okay? Getting a weight, we might delegate that to an adult patient. But a baby that's been sick, that's, not really the right circumstance if you think about it. I want to let you know there's a little worksheet that we've provided on page 13 that has 3 scenarios there with the answers and rationale. So tonight you can look over that and see if you get those correct, and if you have any problems with the rationale, you can ask me tomorrow.